Hello everyone, it's great to see you all here today. Today we're talking about a topic that's near and dear to my heart: skin health, especially for seniors. As we age, our skin becomes more delicate and requires extra care. As we age, our skin goes through many changes, and it's more important than ever to be vigilant about protecting it. This means regular checkups, using sunscreen, and being aware of any changes in our skin. One condition we need to be aware of is squamous cell carcinoma, or SCC for short. It's a type of skin cancer that can appear as a red scaly patch, a sore that doesn't heal, or a new growth. Don't let the big words scare you. SCC is a common type of skin cancer, but the good news is that it's highly treatable, especially when caught early. Regular skin checks by a dermatologist can help catch any suspicious spots before they become a bigger problem. We're going to break down everything you need to know about SCC, from what it is to how to prevent it. Remember, knowledge is power. By staying informed, we can take proactive steps to protect our skin. By understanding SCC, we can take charge of our skin health and enjoy our golden years with confidence. So, let's dive in and learn more about how we can keep our skin healthy and vibrant. First, let's talk about what causes SCC. Prolonged exposure to ultraviolet UV radiation from the sun, or tanning beds, is the primary cause. This is why it's crucial to protect our skin with sunscreen, wear protective clothing, and avoid peak sun hours. Sunscreen should be a part of our daily routine, even on cloudy days. Look for a broad-spectrum sunscreen with an SPF of 30 or higher, and reapply every 2 hours when outdoors. It's also important to be aware of any changes in our skin. If you notice a new growth, a sore that doesn't heal, or a change in an existing mole, it's time to see a dermatologist. If your dermatologist suspects SCC, they may perform a biopsy to confirm the diagnosis. This involves taking a small sample of the affected area and examining it under a microscope. Treatment options for SCC vary depending on the size and location of the cancer. Common treatments include surgical removal, cryotherapy, and topical medications. Your dermatologist will recommend the best course of action for your specific case. The key to successful treatment is early detection. Regular skin checks and being proactive about any changes can make all the difference. By taking these steps, we can protect our skin and enjoy our golden years with confidence. Remember, your skin is your body's largest organ, and it deserves the best care possible. So what is squamous cell carcinoma? It's a term you might have heard before, but let's break it down to understand it better. Simply put, it's a type of skin cancer that begins in the squamous cells. These are the thin, flat cells that make up the outer layer of our skin, known as the epidermis. Squamous cells are essential because they act as a barrier, protecting the underlying tissues from damage, infection, and dehydration. These cells are found all over our body, but squamous cell carcinoma, or SCC, most commonly appears on areas that get a lot of sun exposure. This is because ultraviolet UV radiation from the sun can damage the DNA in our skin cells, leading to mutations that cause cancer. Think about it: your face, ears, neck, arms, and hands. These areas are constantly exposed to the sun's rays, making them more susceptible to developing SCC. It's not just about the occasional sunburn. Even everyday exposure can add up over time. These areas are constantly bombarded by the sun's rays. The cumulative effect of sun exposure over the years can significantly increase the risk of developing SCC. That's why it's so important to be mindful of sun protection. That's why it's crucial to protect them. Using sunscreen with a high SPF, wearing protective clothing like wide-brimmed hats and long sleeves, and seeking shade whenever possible are all effective ways to reduce your risk. Now, it's important to remember that not everyone who gets SCC has had excessive sun exposure. While UV radiation is a significant risk factor, there are other factors at play as well, but we'll get to those in a bit. For instance, people with weakened immune systems, either due to medical conditions or medications, are at a higher risk. Additionally, exposure to certain chemicals such as arsenic and having a history of other skin conditions can also contribute to the development of SCC. It's also worth noting that SCC can sometimes appear as a new growth or sore that doesn't heal. It might look like a red, scaly patch, a firm bump, or a sore that bleeds or crusts over. If you notice any unusual changes in your skin, it's essential to get them checked by a healthcare professional. Early detection is key to successful treatment. A dermatologist can perform a biopsy where a small sample of the suspicious area is taken and examined under a microscope to determine if it's cancerous. Treatment options for SCC vary depending on the size, location, and stage of the cancer. They can include surgical removal, radiation therapy, and topical medications. The goal is to remove or destroy the cancerous cells while preserving as much healthy tissue as possible. With early detection and proper treatment, the prognosis for SCC is generally very good. Most people can expect to make a full recovery and continue enjoying their daily activities. Remember, prevention is always better than cure. Protecting your skin from excessive sun exposure and being vigilant about any changes can go a long way in reducing your risk of squamous cell carcinoma. Stay sun safe and take care of your skin. Early detection is key when it comes to SCC, so it's important to be familiar with the signs. Squamous cell carcinoma, or SCC, is a common type of skin cancer that can be effectively treated if caught early. Knowing what to look for can make all the difference in catching it before it becomes more serious. SCC can manifest in a variety of ways, but there are some common red flags to watch out for. These signs can appear anywhere on the body, but they are most commonly found on areas that are frequently exposed to the sun, such as the face, ears, neck, and hands. Keep an eye out for any unusual growths, sores, or spots on your skin that don't seem to heal. These can often be mistaken for less serious skin issues, but if they persist, it's crucial to get them checked out. SCC often appears as a firm red bump that may bleed easily. This bump can sometimes be mistaken for a pimple or a minor skin irritation, but unlike these, it doesn't go away with time. It can also look like a scaly patch of skin or a sore with a crusty surface. These patches can be itchy or tender, and they may bleed or become crusty over time. Pay close attention to any changes in the size, shape, or color of moles or other marks on your skin. Moles that change in appearance or new growths that appear suddenly should be examined by a healthcare professional. If you notice anything unusual, don't hesitate to see your doctor right away. Early intervention can prevent the cancer from spreading and becoming more difficult to treat. Regular skin checks, both at home and with a dermatologist, are essential for catching SCC early. Remember, your skin is your body's largest organ, and taking care of it is crucial for your overall health. So, stay vigilant and proactive about any changes you notice. Now let's talk about what causes SCC. The biggest culprit? You guessed it, the sun. You see, the sun emits ultraviolet UV radiation, which can damage the DNA in our skin cells and lead to cancer. Years of sun exposure, especially blistering sunburns in our younger years, can significantly increase the risk of developing SCC. But it's not just the sun. Tanning beds also emit UV radiation and are just as dangerous, if not more so. And while genetics play a role, it's important to remember that we can control our sun exposure and protect ourselves. Early detection is key diagnosing and treating SCC. If you notice anything suspicious on your skin, don't panic. The first step is to see your doctor or a dermatologist, a skin specialist. They will examine your skin and may perform a biopsy, a simple procedure where they remove a small sample of tissue to be examined under a microscope. The good news is that if caught early, SCC is highly treatable. Treatment options vary depending on the size, location, and stage of the cancer. Common treatments include surgery, where the cancerous cells are removed, and radiation therapy, which uses high-energy rays to kill cancer cells. Looking ahead, prognosis and the possibility of recurrence. The prognosis for SCC is generally very good, especially when it's caught and treated early. The earlier the cancer is detected, the higher the chances of successful treatment and a full recovery. However, it's important to be aware that SCC can sometimes return even after successful treatment. This is why regular skin checks and follow-up appointments with your doctor are crucial. By staying vigilant, we can catch any recurrences early and take prompt action. Your best defense: simple steps for preventing SCC. The best way to deal with SCC is to prevent it in the first place. And the good news is that there are simple yet effective steps you can take to protect yourself from the sun's harmful rays. First and foremost, make sunscreen your new best friend. Choose a broad-spectrum sunscreen with an SPF of 30 or higher, and apply it liberally to all exposed skin, even on cloudy days. Reapply every 2 hours, especially after swimming or sweating. Sun Safety 101. Protecting yourself from harmful rays. Sunscreen is just one piece of the puzzle. To truly protect yourself, think about sun protection as a lifestyle. Seek shade whenever possible, especially during peak sun hours between 10 a.m. and 4 p.m. Cover-up. Wear protective clothing like long-sleeve shirts, pants, and wide-brimmed hats. And don't forget your eyes. Sunglasses that block both UVA and UVB rays can help protect your eyes from sun damage. The importance of skin checks, your health in your hands. Finally, make skin checks a regular part of your routine. Once a month, examine your skin from head to toe, looking for any unusual spots or changes. If you notice anything concerning, don't hesitate to see your doctor. Remember, early detection is key. By being proactive about sun protection and skin checks, we can significantly reduce our risk of developing SCC and enjoy healthy, radiant skin for years to come. Take care of yourselves and stay sun safe. Thank you for joining me today. Stay vigilant, stay informed, and take good care of your skin. Until next time, take care.